How do you help someone decide between Medicare Advantage and a supplement plan?
Well, when they first come in, I get a list of their doctors, their drugs, and what are your needs? Been chomping on your chompers for 65 years. How much dental do you need? Do you need hearing needs now? Or do you have a history, or does your doctor say that that's coming up? I look at their medical needs. Do they have chronic needs? Are they diabetic? Do they have heart issues? Because there's special Medicare plans for people with chronic conditions, so they'll get more money if you're diabetic, or you'll get more money if you've got heart conditions. And they gear these plans around those people with special needs. So I really get into a whole medical background. Sometimes I've seen people choose a plan based off drugs. They got very expensive drugs.
Right.
And we try to find the plan that's going to give them the lowest amount of drug costs. I can literally break it down from month to month to a penny, what you're going to spend on all your drugs every month. And drugs are capped, by the way, at $2,000 now. So no matter how expensive your drugs are, you're never going to spend more than $2,000 in a year. Drugs didn't used to be capped. That's what they used to call the donut hole. That's all gone.
Are there certain types of people that you feel fit better suited for one route over the other?
Sometimes that's based on their location.
Interesting. So not so much their health, but their location. That's really fascinating.
Because if you give me a 5-year span over years of your life, and I can compare Medicare supplement with the Medicare Advantage, majority of the time I'm going to tell you a Medicare Advantage is going to save you money. Most of those plans, there's no premium. You pay as you use it. The copay is the copay. If I have a $55,000 knee surgery and the copay is $200, all I'm paying is $200. Period. No deductible, no co-insurance. It's just a copay. So if you pay as you use it over 5 years at times, even if you have a horrible year or like me have cancer, the copay's cap. There's a cap on copays, $3,900, $5,000. And because of that, if I run the math over 5 years period of time, over 90% of the time, you're going to save money on a Medicare Advantage. Medicare supplements, the reason why, for instance, there's people on the Colorado border near Kansas, some of those counties, there's just no Medicare Advantages in those counties. And so we have to do Medicare supplements. Wyoming is one of those states where majority of its Medicare supplements, there are Medicare Advantage in certain counties, and it works well in those counties. And then even if you buy it in that county, you can use it anywhere you want in Wyoming or Montana or Utah. There's certain counties that have Medicare Advantages and some don't. I will look at the state and county you belong in. States like Wyoming that are new to some of these Medicare Advantages or just starting to implement them, I may still recommend supplement because I don't feel the product's strong enough yet. So it's really going to come down to where you live and the numbers. Believe it or not, each state is very unique when it comes to Medicare.
Interesting. So it's not standardized.
There's even some boutique plans. Like in Colorado, we've got a couple carriers, 2 carriers that are boutique. It's very much for our medical system. There's different states that have plans that are specialized for their state. And when you get people that don't leave, they're not traveling, they're not in their younger years, they're in their older years, and they really don't move but 30 miles outside their little bubble. Sometimes those plans offer quite a bit of benefit for them. That's why it's nice to evaluate your plan every year, where your health is, what your travel's like, what you're doing. People that don't move very much and kind of stay in a certain area can really get their copays way down and their costs way down because they can buy those specialized plans for those areas.
You just said something that I'd like to expand on. How often should somebody be revisiting their Medicare decision a year ago? Should it be an annual thing? Like from your expertise?
For sure. Medicare supplements, just so you know, you get 6 months to buy a plan and not be medically underwritten. After 6 months on a Medicare supplement, you have to be medically underwritten. You can't have a lot of equipment in your body, like a bunch of surgeries, not diabetic. I mean, supplements are the only plan that real major medical policies in the United States where you got to be medically underwritten. Medicare Advantages, they take you no matter what.
So you pay more for Medicare Advantage?
You pay more for Medicare supplements.
I'm sorry.
Medicare Advantages don't cost anything. Medicare supplements are expensive and they go up every year. Plus you got to buy a drug card and that goes up every year. And if you think about it, you got a Medicare supplement or drug card, right? They're 2 separate things. Standalone drug cards are going to get really expensive because they have to cap those drugs at $2,000. When you've got a Medicare Advantage and the drugs and the health are all in one, they can spread their loss ratio into the medical. So drugs are much cheaper usually on a Medicare Advantage and the cost doesn't go up every year. On a Medicare supplement and a drug card, the costs are very, very high.
Are there better plans for people that are healthy versus unhealthy?
Yes and no. I'll say yes in the sense that there are some Medicare Advantage plans out there that are meant for healthy people. Not only do they give them free gym memberships, but they give them $90 every quarter to go buy extra memberships to pickleball or camping or hiking or ski passes to keep you healthy. There are even some Medicare Advantage plans if you're sick, like let's say you're diabetic, they'll give you $100 a month in healthy groceries and they have to be healthy. Fruits, vegetables, meat, dairy, not canned fruit, things like that.
Interesting. A whole bunch of caveats. Is there anything you don't know about Medicare? Probably not. You can just tell.